So no panic at this point in time, but we are seeing a bump up in cases. To find out more about what the situation on the ground is, especially across the Delhi NCR region, we're joined by Dr. Ashok Seth of Fortis and Dr. Ambrish Mittal of Max Healthcare. Doctors, thanks very much for joining us here on the program. Dr. Seth, let me start by asking you, we are seeing a pickup in cases across the NCR, in the capital as well. But what are you seeing on the ground? While hospitalization rates haven't picked up just yet, when you talk to people who are testing positive, are they reporting mild symptoms? What are they coming to hospitals or doctors with? What queries are they coming to doctors with?
So, Shirin, it's a very, very important question, and I think we all agree with the fact that there's no panic and the fact that this was to be expected as we normalize and learn to live with the virus. The virus is living amongst us, and therefore these bumps are expected. But that's true. We're not seeing serious cases. For example, we haven't had a single COVID admission for the last practically 4 weeks, despite the fact that we've got 40 beds of COVID available to us. And also for the fact that the only single patient who got admitted was an incidental finding of a COVID positive in a patient who'd come for another procedure. So that's the other aspect. Yes, the number of cases that you see arising are a reality, but I'm not concerned about the fact because these are mild cases, these are being treated at home, and that is the reason why they're isolated at home. Having said that, the normalization is appropriate. There's no question. I don't think we need to move backwards. We need to go forwards, and we're going to see this happening more and more, maybe less, maybe more. But what is important to understand is that we are now in a different world altogether compared to last 2 years ago. Vaccinations, double vaccinations are practically complete. There's another form of immunity related to past infections. And so the people are more, how should we say, immunocompetent than they were against the COVID a year ago. But clearly, when we say mask mandate off, I'm slightly concerned that people will mistake it for the fact that now we can be careless and callous and that the COVID is not around us. I think what we should understand is that the responsibility lies with us now rather than mandates and rather than rules and regulations. And we continue to take precautions and be less callous and be more careful as we go along. Because yes, it can affect us. And let's not even forget that mild cases may not need hospitalization and vaccinations may prevent severe infections. But I still worry about the long COVID, which people do have and actually continues to, in some way, disturb our lives for months and months, even after a mild COVID infection.
Well, that's absolutely right, and we are still trying to grapple with and fully come to terms with what long COVID entails and how it does impact different individuals differently. But Dr. Mittal, let me address that issue with you. As we just heard there from Dr. Seth, this normalization is now part of what not just India, but all economies around the world are coming to terms with and moving ahead with. At this point in time, we've got a universalization of the booster dose now. 18 plus, anyone can opt for a booster dose if they like, but the numbers are not picking up. So if there is a single message that you would like to give out to people at this point in time, do you believe that they should go in for the third dose? Do you believe that that is the appropriate personal protection measure to take?
Yeah, thank you, Shirin. I think it's important to understand that no single measure works in this area. There's always a combination of things that works well. So we have to do all the things that we can to reduce the spread, recognizing the fact, of course, that this is still the some Omicron variant, probably BA2, maybe XC, which is causing this outbreak right now. The fact is that we do have to ensure that if we are eligible for a booster, we should go for a booster, number one. Number two, when we are meeting people in indoor environments, it's quite important to wear a mask, in indoor environments at least, especially if there are a large number of people. Maybe one-to-one, you may still be you may let your guard down a little bit, but otherwise no. Third is that one of the things that we are seeing is that people, because some of the Omicron infections appear like just cough and cold or just flu, they are not testing. And I think it's important, if you get an infection, any symptom, you should test so that it will help you isolate. And the fourth thing is, if you do get it, there is no need to panic, and there are lots of you just need symptomatic treatment, but you do need some degree of isolation. And I think that's the only thing we'll have to live with, that we should test when we get any symptoms and we should isolate to avoid spread. We should wear masks in indoor crowded environments. And yes, if we are due for a booster, we should get it.
Yeah, if you're due for a booster, and especially if you're immunocompromised, then do consider that option. That is the advice coming in from the doctors here on the panel. But Dr. Seth, I want to address another issue with you. What we are now once again starting to see is this reactionary move when it comes to schools, because there are cases being reported in schools, the move to shut down schools once again. Are you seeing any disproportionate increase in the number of children that are being reportedly down with COVID at this point in time? And what do you believe the way forward needs to be in being able to deal with this at the level of school? Because, as I pointed out, many authorities are now saying, okay, if there's a case, then shut down that wing or shut down the entire school all over again.
So very clearly, and I think unambiguously, the schools should not shut down. We need to move ahead. We can't actually sacrifice the education, and I mean all-round education of children at the altar of COVID any further. And we must also remember that it is COVID-appropriate behavior which is becoming more important in schools. We know that there's a large proportion of children who are now being vaccinated, and they should be double vaccinated, all above the age of 12 years. So we are actually seeing, and then again, we must remember that much of the children have already developed immunity through silent infections, and that's also been well documented. So I think we need to move ahead. I think of the very clear fact that at schools, yes, the distancing, the masking, the teachers being masked, emphasis on the COVID appropriate behavior, all becomes a part of the norm, but education should continue. And we certainly not really panicking about children and schools, with a clear mandate that let's move ahead. We know how to actually make sure that this does not spread, and therefore certainly more precautions in schools. Let's not remember the mask mandate always concerns me that it was taken off, because really the responsibility now lies with school children, responsibility lies with the school teachers, responsibility lies with the school authorities. But those pictures have to be clear now. And again, one thing I would say for schools, please, let's lay down the rules and regulations now for schools. And I would urge the government to actually come up with those issues. Say, for example, if a child does come to be positive, there's a panic within the school, there's a panic amongst parents. What are the isolation parameters? When does that child come back to school? How do you isolate a wing, or how do you actually clean that area? All those are important aspects, but the schools don't stop. Education continues.
Absolutely, and I think that is something that state governments and authorities need to focus on. We've already lost over 2 years, and we cannot afford a situation of shutting schools all over again. But Dr. Mittal, let me address that very same issue with you. We do understand that, for instance, in Delhi, there will be a meeting of the authorities to take stock of the current situation. As per the graded plan, we've already crossed the threshold when restrictive measures should have come into effect. Now, it's a very different situation than we saw through the course of Delta, or even through the course of Omicron. Do you believe that there is now a need to review this graded plan itself, given the reality of the situation, that you're not seeing hospitalization? We didn't see a significant increase even through the course of the Omicron wave, and certainly not at this point in time. So do you believe that there needs to be an overhaul, even as far as this graded plan is concerned, so that the restrictions that were relevant then perhaps have lost their relevance today and are not reimposed?
Yes, I agree with you, Shireen. I think there is no doubt that the graded plan was very well crafted, very well designed, but it was for a different situation. It was for a situation where the prevalent virus was not Omicron. We have learned from Omicron wave in January and February what it does and how it creates trouble or doesn't create trouble. We also have greater and greater vaccinations. We have an enviable record in vaccinating our country, our city. I think it's important that we do not have knee-jerk reactions. I don't think that serious restrictions are in order. I think more advisories than restrictions, and maybe some clear written guidelines for schools, because that's where there's a lot of confusion. But I totally second what Dr. Seth is saying. We cannot think of closing schools if some child gets infected. So you're absolutely right. The graded plan, the response has to be scaled down. It has to be looked at differently in the light of our experience in January and February.
Absolutely. So what was relevant pre the Omicron wave, where we did see through Delta a rapid rise, not in the number of cases, but in the need for hospitalization. That was not the case in Omicron, and that is certainly not the case today, where you are seeing a bump up in the number of cases. So we need to repurpose our response appropriately and adequately. Dr. Seth and Dr. Mittal, always a pleasure. Many thanks for joining us here on CNBC TV 18 to take us through where things currently stand on the COVID trajectory on the ground in the capital and the NCR region. We will head into a short break, but up next, the All India Power Engineers Association